So could you please briefly introduce the current situation and plans of the Oxford University in promoting research and application of HIFU technology?
So we have had a very good relationship with Chongqing HIFU for over 20 years, since 1919. So we started with looking at kidney and liver cancer, and we got the the JC machine from Chongqing HIFU CE marked for Europe. We now have 20 or 30 machines in Europe. So over the last few years in Oxford, we have been looking at doing trials on uterine fibroids and various cancers. So we have looked at kidney cancer, liver cancer. We're now looking at pancreatic cancer. We are looking at sarcomas, which are locally invasive, not necessarily malignant, but very unpleasant tumors. So we are hoping to start a trial looking at breast cancer, and we are going to look at further uses of HIFU with kidney cancer. We have also used it on cancers in renal transplants, and we are also very interested in the immunology. So we are interested in whether you can produce an immune response which may have an effect not only on the primary tumor but also on metastatic disease. And if that is true, that would be very interesting, because it may be possible in the future to treat metastatic disease. So, for example, if you have a tumor maybe in the kidney, which is difficult to treat, but you have secondary tumors maybe in the liver, and you treat the secondary tumors, it may have an effect not just on the tumor that you're treating, but on the other tumors in the body as well. So in the future, it may be possible that you treat one area of cancer and it has an effect on the other cancers in the body.
So what's the evaluation of NICE to HIFU technology?
So for NICE, National Institute of Clinical Excellence, we worked very hard a few years ago to get fibroids, uterine fibroids, accepted by the National Institute of Clinical Excellence. So they accepted that for ultrasound-guided treatment of uterine fibroids in 2019. And over the last few months, we have been trying to get the indications slightly broadened for it. So we are waiting for NICE to report back to see if we have wider applications. At the moment, we can use HIFU for uterine fibroids, but only in specialized centers. Having said that, we have the only center in the UK at the moment for fibroids, but I know that other parts of the world, in particular Singapore, look towards NICE, and the NICE recommendations are important not only for the UK, but also for other parts of the world. At the moment, we do not have NICE approval for any of the other treatments, HIFU, ultrasound-guided HIFU treatments, apart from prostate cancer, although that is a machine that is not a Chongqing machine, that is machines made elsewhere in France and elsewhere. So there is NICE approval for prostate HIFU, but over the next few years we will be working on NICE approval for some of the other tumours as well, maybe kidney, maybe sarcomas, maybe liver, but we have to do further trials first before we can do that.
The third question is about, as the chairman of the International Society of Minimally Invasive and Virtual Surgery, what do you think of the contributions that this organization made to the development of the minimally invasive and non-invasive medicine?
So I think what the society has done has brought together a lot of people who are all very interested in minimally invasive, but in particular virtual medicine, in particular HIFU. So I think the society, which has been going for quite a few years now, has brought together people from around the world who are interested in this technology. And one of the other things that the society has done during COVID, when we could not meet together, we have still been very active with a lot of seminars and online tutorials. And the other very exciting thing about the society is that now there is a youth society of younger members, and I was at the meeting a couple of evenings ago when they were electing a chairman and international staff for the Youth Society of the International Society of Minimally Invasive and Virtual Surgery. And of course, it's the young people that are the future of surgery. So I think the inauguration of the youth group is very important.
And for the first question is like, so during the Young International Summit, what the new technology or the perspective you will bring to us?
Well, we are bringing some of the updates of the trials that we have been doing in Oxford, but also we are here to learn from the other people. We have just heard some very interesting talks, including from Professor Lang, who has been a friend of mine. He was not able to come, but he was one of the founders of the Chinese Osler Society. So we were talking about that earlier, because William Osler, who was a Canadian and then went to America and then came to the UK, but he was very humanitarian, and he talked about diseases that require treatments that harm less, which is what HIFU is all about. And Professor Lang today in his talk was talking about the importance of humanity and of thinking about the patient, not just the disease, which I think is very important. So I think coming to China, we bring what we have done in Oxford and the studies that we have done in Oxford, but we also come to see the new technology that's being developed and to hear the new studies that are being done in China. So it is very much a two-way collaboration.
Okay, is it okay to just share what the new technology you are researching now?
Yeah, sure. So, I mean, we have the Chongqing HIFU machine, the JC200. We still have the only one in the United Kingdom. We had it CE marked for Europe in 2005. So now there are about 20 machines around Europe. But our particular interest at the present time, we are still treating some fibroids, but our particular interest at the moment is we're treating pancreatic cancer. And we're also looking at the immunology. So we are taking blood samples and looking to see if there is an immunological effect. So, you know, if you are treating with HIFU the primary tumor, what effect does it have on other areas of the body? So that is our main one at the moment with fibroids. We've also recently done targeted drug delivery, which is very exciting. So this is using hypothermia, so it's using the same machine but just warming up the tissue. So if you put drugs into something called liposomes, which are stable at 37 degrees centigrade but break open at 42 degrees centigrade, what we have done with some liver tumors is that you heat the tumor up to 42 degrees centigrade, you inject the drug peripherally into the vein, and then as these liposomes go through the tumor, they break open, and you get a much increased cytotoxic drug delivery to the tumor. So something that's at an ordinary dose going around the body will not have very much effect. With this, it's a very increased dose in the tumor. So firstly, it affects the tumor and breaks down and kills the tumor, but also it does not have a damaging effect so much on the rest of the body. So that's one area that we're doing.
Yeah, thank you. Okay, the next question is like, to promote the comprehensive development of minimal invasive medicine. What aspect do you think China or Chongqing should focus on to strengthen the academic exchange between like the international and
Yeah, well, I mean, the wonderful thing about medicine is that we have good relationships all around the world, which is wonderful. And we have big links with the Focused Ultrasound Foundation in the United States. And the president of that, Neil Casals, is giving a virtual talk in just after lunch here. So I think medicine is fantastic, that it can cross all sorts of boundaries and bring humanitarian and bring increased technology to the benefit of people around the world. So Chongqing, I think, is at the forefront of the technology, but not just the technology, because Professor Lang and Zibiao, Professor Wang, have a very humanitarian approach. So very concerned not just about the medicine, but about the person and about treating the person, which is very important, which is what William Osler spoke about, and which we're very impassionate about as well.
Okay, thank you. So next question is like HIFU is a very impressive technology, and so for the independent, the intellectual property rights. So what do you think the China or Chongqing or like internationally, like globally, like so how to protect this like the property rights to promote the medicine?
Yeah, sure. Well, I mean, that's something that the business and the other people have to do. I know that Oxford University has had very good discussions and collaborations and about this, because obviously, you know, scientific research that is based in Oxford, they are keen to protect their intellectual property, just as anybody who designs new technology is, it's important to protect your property. So, I mean, I think it's important to have those discussions, and I know that you know, when we have wanted this technology in Oxford, we have had to talk to the university. We have also had to talk to Chongqing Medical University and have agreements as to, you know, protecting your rights, protecting Oxford University's rights. So I think it's important to have those discussions, and it's not me particularly that has those discussions, but it is senior people in Oxford University and in Chongqing Medical University that have those discussions and come to agreements.
Okay, thank you. The last question is like, so as we know that we have the title with the road and like the Belt and Road, right? So we also have very intensive the relationship between like the countries. So what do you think how to help the construction of the Belt and Road and promote the China's like original large scale high end the machine to export to the Belt and Road country, and to how to like even like globally?
Yeah, well, I mean, certainly from our point of view, we've had very good relationships, and it's a question of having the agreements. I think one of the things that it's important to think about is not just promoting it to countries where just the rich people can afford it. And I think the countries that have the machines and bring them have to think about how it can be available to the whole population, not just people with a lot of money who can afford it. So I think it's important that as it is rolled out across the country, you know, I think a lot of it in due course will be, you know, cheaper than some of the major surgery. And for example, so when we're treating uterine fibroids, we do not need a big operating theatre. We do not need all the staff around. We do it in the radiology department under sedation. So I think the HIFU can make the treatment, as it gets better, it may also be cheaper and less use less people. But I think one of the things that we do need to think about in China, in UK, everywhere that it has, is that this technology is for everybody and not just for people who have a lot of money.
Okay, yeah, that's it. Thank you.
Thank you very much. Thank you.